First of all, I'd like to wish the Minister well and hope he can be progressive and bold in his job in the next previous years. And the Minister, I think the government need to be bold, because this is like Groundhog Day. We're talking about the same things. We were talking 2-3 years ago in this chamber, and people have been talking about this issue for decades. And it's welcome that we're talking about a health-led approach rather than a criminal justice approach, because the criminal justice approach simply doesn't work. And obviously last year's alternative approaches to possession of drugs for personal use was welcome, but it didn't go far enough. Now, I understand that the sentiment of that report is going to be sent to the Citizens' Assembly. Now, I just have a problem here, because we are legislators. Like last February, 160 of us got voted by the people of Ireland to legislate. Even though the Citizens' Assembly do very, very good work, but we are legislators here to make laws. And Minister, the present system simply does not work. Simply does not work. Bringing people through the courts for small possessions of drugs is a complete waste of time. Absolutely complete waste of time. Bringing somebody towards through the criminal justice system for €50, €100 worth of cannabis, absolutely waste of time. For everybody's time, police time, state's time, everybody's time. So there needs to be a health-led approach into this. And just the benchmark, Minister, is Portugal. In 2001, they embarked on a decriminalisation road. It's a difficult road to go down. Like, drug use and drug abuse is very, very difficult. I've seen it in my own community where drugs take over a community, they take over people's lives, and it's extremely difficult to deal with, both in the community and on the personal level. And obviously that's compounded by the class nature of society, through austerity, through cutbacks to youth services, because international evidence and research shows if you invest in people, in communities, you will have less people turning to drugs. Why would people want to turn to heroin in the first place? Think about it. It's the most horriblest drug in the world. But people are desperate sometimes. They are absolutely desperate in situations of alienation, and they turn to that because of the class nature of society. And that's not abstract when I say that. You look at communities across the world where the likes of heroin particularly gets into them communities. It attracts, heroin is a kind of a devil that attracts into poor, poverty, and marginalised communities, and that's where it manifests itself. And obviously, Minister, there's an alternative economy that goes on in society, and it's hugely lucrative and hugely violent. So there's no kind of, I suppose, in the last 10 to 15 years, the violence that is attributed to drug use and the market of drugs is ever more violent, because it's so lucrative that it's impossible to put down. Regardless if you had 20,000 guards on the street, it's impossible. Once people want a substance, they will get it. Once there's a market for it and demand, there has to, there will be kind of people will use it. And we have to be very grown up about this conversation, right? People will use drugs, will abuse them, and they use them. And they're from every form of society, every form. And our heads are in the sand if we keep locking people up and bringing people through the criminal justice system. It's simply a waste of time. So, we have to be bold. We have to be a different approach to addiction and why people turn to addiction. Because, Minister, if I'm still around, we'll be still talking about this issue in 10, 15 years' time, about the kind of the cruelness of bringing people through the criminal justice system. So we have to have a new approach, and that approach is very kind of nuanced. I think there has to be an approach about legalisation for certain drugs, and decriminalising the person rather than the drugs itself. That's going to be a different argument. As I said, international evidence shows across the board, when you have a health-led approach, you have better outcomes, because what it comes down to in relation to this issue, it's saving lives. If you can save lives by taking people out of the criminal justice system, then you're on the right road. It's not going to be easy by any means. It's difficult. It's extremely difficult in circumstances when it comes to drug addiction and drug abuse. But Minister, the approach in the last successive governments has been a failure. Let's be honest, it's been a failure. It's Groundhog Day, constantly. So we have to have a different approach, and some of the approaches, as I've just outlined. Thank you.
Thank you, Deputy.